This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Okay, so liver function test, or basically just how about the comprehensive metabolic panel? You see us order it all the time, right? Part of that is the liver function portion where we see on our comp, it's the ALT, AST, and ALK-Phos. If you order a liver function test, you get the GGT too. So most people probably know the term transaminitis. So the transaminases are the ALT and the AST and the other specific liver functions. Transaminitis, most people, when you see an abnormality there, you think of this as an acute liver issue. There's some kind of liver injury, but not all transaminases are equal. So if you see an elevation, and usually when you see one of those numbers elevated, the other ones are kind of elevated along with it. So if you see an ALT that's elevated, usually that is pretty darn specific to the liver, the ALT. But the AST itself is found in all sorts of different organs and even muscle. And so the reason I bring this up is sometimes you see somebody who's got something metabolic going on, but you're not totally sure what it is. You see some elevated transaminases. They look like they have a transaminitis, but the AST is elevated much higher than the ALT. This actually can be specific to muscle and not the liver at all. There's several studies that show that rhabdomyolysis will show up many times when people order a comp or liver function test with an elevated AST higher than ALT ratio. They're both up, but it's significantly higher in the AST. And you add on a CPK, and bingo, you have your answer there. So traditionally in the studies they've done with people who are proven to have rhabdomyolysis, they'll check some liver functions, and the usual ratio is about 3-to-1, AST over ALT. So just because you see a transaminitis, it's not always a liver problem. So thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.